Good afternoon, everyone. My name is Mychi Nguyen. I'm an internal medicine physician at Asian Health Services, and I provide primary care services to a very diverse population in Oakland. And one of the things about the Nail Salon Collaborative and its initiatives, it's very personal to me, is that I'm a Vietnamese provider and provide services to a very large Vietnamese population in Oakland. And on a personal level, my mother was a former nail salon worker. And so the things that we've discussed today have all come up in terms of, how to maintain health, chemical exposures, and the working environments that our patients and our communities are affected by and going through. And so as a provider and as a physician, I'll be going over some tips for fellow providers and other healthcare folks working on the front lines with patients. I think we have a great responsibility in addition to taking care of the patient overall is to think about not only diagnosis, but we also have an opportunity to really partner and engage with patients where, easing concerns, maintaining their health, and most importantly, preventing adverse outcomes in terms of prevention and education. And so one of the things as a provider that gets kind of missed or goes under the radar is looking at people's jobs and the communities that they live in. Now it's becoming more trendy and people are more aware of the social determinants of health and how important that is. And one of the things about that is the occupations, the jobs that people do and how it affects their health. So some of the things that we talk about for providers is that by discussing occupational health, it really will give patients a feeling of safety by providing them helpful information about their jobs. As you know, we serve a very large low-income monolingual community, and telling folks to quit their jobs or stop working is not a practical or financially possible thing. And so how do we identify the occupational related health impacts and hazards for them, and really making some practical steps and solutions for them to continue working and making money and making a living wage so that they can support their families and at the same time be healthy. Additionally, too, and Julia had also mentioned, really just taking it out of the provider-patient exam room and really connecting patients to the community and resources that are available to help them. So next slide. So as Julia mentioned, there is a provider screening tool. So it can seem very overwhelming when patients come in with multiple complaints. And where do providers start from in terms of occupational health, especially if you have a Vietnamese patient coming in and they are a nail salon worker. So some of the things we always ask is, the usual, how long has it happened? Where did it come from? What do you think causes it? Some of the things that I've actually started to ask folks is, what kind of work do you do? And if they tell me they are a nail salon worker, when they come in with skin flare-ups or muscle aches or pains or dizziness or some type of respiratory condition, one of the first few questions I ask is, what kind of work do you do? And then, are these symptoms improved at home or when you're off of work? And so if the answer is yes, then it really keys in into certain areas of their condition that might be triggered by the work that they do or the chemicals that they're exposed to. So some of the, as you can see on the screen, the writing is a little bit small, but you'll have access to this later, is that it's a workflow diagram when patients come in, key screening questions. But the biggest ones to look out for, as we talked about, are skin flare-ups, muscle and joint pains, and dizziness. And so a key question that we ask over and over again is, what makes it worse? What makes it better? And if these symptoms improve after they stop working, then it really helps you to kind of discuss further what kind of conditions that they're working in. And so as a clinician, we're really uniquely positioned to help our patients who work in nail salons understand the medical complaint and the complaint that may be related to their job. And then also when the patient expresses concerns about working in the nail salon, it can really be a starting point for engaging with the patient and partnering with them to find tips and key strategies that they can do at their job. So next slide. So I wanted to start with some case studies that I come across in my practice. So the first case is a 27-year-old Vietnamese patient, and she comes into my office complaining of these red, itchy rash on both her hands. And then if you can click on the next. Yes. So one of the things, and so we'll be going through the cases, is that I usually ask, how long have you had this rash? And so she said that she's had this rash for about a week. And then the next few questions I would ask would be, how often do you have the rash? And she says that on and off, she's had it for years, but it doesn't seem to get any better. And she's seen me multiple times and multiple drop-in visits with other providers and has been prescribed various topical creams, which do help, but only temporarily. And so she's back again with a similar rash and a similar complaint. And so using our provider screening tools, I ask her about, when do you get this rash? And so she says she gets it more frequently after working at the nail salon. She doesn't wear gloves because it makes it harder for her to do her jobs, and she's noticed customers complaining that they don't like it. And so it's from an aesthetic point of view, and also from a tactile artist, the patient feels like she isn't able to perform her best if she has gloves interfering with her painting nails or designs. And so those are some of the things that we have received information about during our visit with her. And so as I'm looking at her case, it would be very easy and a 2 to 3 minute visit if I just prescribed her a prescription for a cream and make it go away. But it really then would miss all the other areas where we can impact patient health and also education, and also to stop the cycle of repeated visits. Since you've looked back and she's had this for several years, it temporarily gets better, but it doesn't necessarily go away. So knowing that she's a nail salon worker, what would I do? And so for this 27-year-old female, one of the things I think about is her last name. She gets it more when she's working at the salon, and one of the things that could help prevent rashes on your hands is usually it comes in contact with chemicals. And so one way is to provide a barrier between your hand and the actual chemicals by wearing gloves. But as you can see, she's saying that she doesn't like to wear gloves. Number one is that it makes it harder for her job, and also that customers, she's perceiving that customers wouldn't like it if she wore gloves. So in terms of education, one of the things that I would like to start with her is asking, what type of gloves has she tried? And usually the cheapest types of gloves are the latex gloves that are available in salons. And so, I'm not sure if folks have worn latex gloves before, but some, they're kind of floppy, they don't fit well. And for folks who've used latex gloves to either mix chicken or, paint or do some other things, you can tell they're very flimsy and they're actually permeable to a lot of chemicals. And so we actually do not recommend latex gloves or any other type of gloves. The only gloves we recommend for folks, if they are to wear gloves, is the nitrile gloves because they are non-permeable to a lot of the chemicals. And then in terms of the patient concern that she won't have the tactile kind of stimulation or being able to use her hands well with gloves, there are gloves that are able to be fitted more to her hands and to be able to have that same surgical precision, as you will. So as you know, surgeons and other people in other fields definitely need to use their hands, and they wear gloves to help protect them from blood and other chemicals and body fluids that they're exposed to. So in terms of getting appropriate gloves that give you also protection, but also that fine skills kind of sensation is possible. So just kind of engaging with the patient on that sense. And then trying to figure out how to prevent these rashes from occurring is number one with gloves, and also to ask her about, what kind of work does she do? And so for a lot of patients, they could be nail salon workers, but there's also folks who do nail and also hair work as hairstylists. So making sure that is she solely doing nails or doing hair and nails? And then if she's a nail salon worker solely, what kind of chemicals is she exposed to? So there's several different types. There's nail salon workers who do acrylics, and they're exposed to a lot of the dust and powder and liquids and gels. And then also if she does a lot of massaging, so a lot of the nail stylists and manicurists will also kind of massage customers in terms of, so they're exposing their hands to a lot of water, chemicals, and a lot of skin irritation. So making sure that the patient is aware of good hand washing techniques, and also to moisturize to keep that skin barrier intact, because that's her main protective layer, and really will prevent her from getting rashes over and over again, and using the steroids sparingly. And so those are some of the things that we talk about with her. And then I would probably see her then more frequently to make sure that the recommendations that we've made, and if she's able to try them and has it helped with her rash, and to notice if there are any triggers. And something that folks may miss too is that I would look at, the first line, 27-year-old female. So she's young and she has a very long, career ahead of her. And so as a 27-year-old, she is of childbearing age. And so another question I would probably ask her is she pregnant, and does she plan on becoming pregnant? And the reason I would ask those things is because counseling for a lot of patients who are pregnant or come in pregnant, they don't worry about themselves, but when they get pregnant, there's another human being that they're responsible for, and so it changes a lot of things for patients. And some of the things they ask me is, I do really need this job, but is it safe for me? And what are the things that I can do to, prevent any harm to my unborn child? And so this is a perfect segue to really educate patients about prevention and safety, and we can talk about more in the following cases, that it would be good for all patients and not just pregnant patients, but they are particularly vulnerable in terms of preventive techniques. So we can go into the next slide, the next case study. So the next case study is not a childbearing age, but an older woman who I actually do see a lot. A lot of patients who go into the Vietnamese nail salon industry, they usually are older Vietnamese women, and it's because it's a field that requires a little bit of English, but that they're able to use their skills in working with their hands, and they get an opportunity to interact with clients. And so it's a very popular line of work for them. And so our first case study was very young, and our second case study is an older woman. She's been doing this for several years, and she's coming in complaining of multiple joint pains in her neck, in her back, in her wrists. And so it's kind of hard to pinpoint where this is all coming from. It's kind of like patients coming and say, I have pain all over. So we're really going back to our provider screening tool, knowing what kind of work she does and asking more of those relevant questions. So if you can click on all those questions, thank you. So one of the things we go through is how long have you had these symptoms? So she's saying it's worse in the past 2 weeks. And I would ask, how often? And so she says she gets it on and off for the past few months, but it really is bothering her for the past 2 weeks, more so that she's unable to really sleep well or kind of do her job effectively because of the pain. And so the next few questions I would ask her is, when do you get these symptoms? And then she said, when I lay down and rest at night, it does feel better. It's worse after working, especially during busy holidays and after working long hours. So a lot of these patients work 8 to 10 hour a day. They work 6 days a week. Some work 7 days a week. And so, and then a lot of the work is seasonal. So during the holidays or during busy, times, they work very, very long hours. And so this can exacerbate, any type of neck, joint, or muscle aches that they may have, from sitting in a position too long or bending too long. And then this is a cumulative effect, and it occurs more when she's working long hours or during a busy time when there isn't time for rest. So some of the things that I would look at, and ruling out any fractures or any falls. If this is just, coming in and this neck pain just develops over time, some of the things I would ask her is, what type of work does she do? Does she sit on a stool? Does she bend over? Does she sit at a table? And how is she sitting? And what kind of work tools or positioning does she adjust herself for her work? And how many hours does she stay in that one position? As a lot of us, if we were to sit at a computer or a desk in the same position for 10 to 12 hours a day, 6 to 7 days a week, we would probably get some sort of carpal tunnel or neck strain or eye strain. And so the nail salon workers who do this repeatedly on a day-to-day basis are no different, and they do get a lot of ergonomic issues. But in terms of education for ergonomics, it's not as readily available as you would have at, like, saying, working in an office where your ergo people could come in and help you adjust your desk and your keyboard. So some of the things that we try to do in terms of education is really to see how the patients are working and asking them to really adjust their chairs and their tables and their lighting to make sure that it's a comfortable position for them. And also one of the things that, I've noticed that my Vietnamese patients do is that they always tend to go towards the patient or the client. So if their customer is, in a certain position, they would, try to not disturb their customer and go towards them and just kind of bend over, lean over. And so some of the things that we ask them to do is actually to raise the customer or the client's hand or foot and to them. So bringing the client to them and raising the client's hand or foot in a comfortable position so that it makes their work easier, and also it helps reduce any type of strain or pain. And also for them to slow down. I know it can be very quick and fast, but really to have them take breaks. And then also if they're able to really do a lot of any type of stretching in between clients to reduce the strain on their necks and backs. So next case. So this last case is a 45-year-old Vietnamese male salon nail worker, and he's actually an owner and a worker, and he's coming in complaining of dizziness, headache, and some difficulty breathing. And so some of the questions I would start asking him, if you can click down those questions, thank you. So I wanted to highlight that a lot are Vietnamese female workers, but there are also nail salon workers who are male, and they're also owners in addition to workers. So there's actually a unique opportunity to engage with the owner as a patient and also as someone who can affect change at their nail salon. So some of the things I've asked this patient is, how long have you had the symptoms? So it looks like it started yesterday. And how often? I said it's his first time getting these symptoms. He was actually very worried that he could be having a heart attack because of the dizziness, the headache, and the difficulty breathing. And so I started asking him more questions and was able to rule out that it was not something cardiac or coming from the heart, but rather it was very atypical and not usual of, heart attacks. And he had described that these symptoms occur mainly when he's working. And so usually as a nail salon owner, he doesn't work every single day, but usually steps in when his workers are out or when the shop gets busy. And so he's noticed that it had come on when he started working. And so some of the things that is very common for a lot of nail salon workers is respiratory conditions. So we had talked about, skin issues and also muscle and joint aches. But there's a lot of kind of nebulous things that can be described, such as dizziness and headaches. And so it can come from a lot of things. And so when you combine that and ask more questions, we realized that a lot of his concerns were coming from the ventilation in his shop. And so one of the things is his shop was in a strip mall, and so he doesn't usually let the door open. And usually in the winter times, if it's cold, he'll keep it closed, and so it really reduces the fresh air and ventilation from coming in. So just talking to him about that. And so one of the things I talked to him about is really very good ventilation. So either if there's not ventilation at the table, really opening the doors or windows if the weather isn't too cold, and also really choosing safer products for his nail salon. So products that don't involve some of the chemicals too had mentioned. The biggest ones are what we call the toxic trio, the toluene, the formaldehyde, the dibutyl phthalates, and also using good practices in terms of teaching his staff about good body position, good practices of disposing chemicals, and using the proper protective equipment in terms of gloves. And then also learning more about healthy nail salons and how he can be a healthy nail salon and really create a work environment that's good for him and also his workers.